video is about malaria. It is a very deadly disease. In 2012, 207 million clinical cases were reported. 627,000 of those resulted in deaths. However, these numbers seem really high, but the mortality rates have decreased drastically since 2000. That's mostly due to people donating to organizations that take preventative measures such as bed nets and preventative medicine to the countries that are hit the hardest by it. It is the worst in tropical and semi-tropical areas. The most deaths occur in sub-Saharan Africa. More specifically, that's in poor areas of Africa. Malaria itself is a cause of poverty because people who are that sick can't work or even carry out their daily activities. Thankfully, it was eliminated from the U.S. in the 1950s, but we still see a few cases every year because of people who travel and new immigrants. Very few cases have actually been transmitted in the U.S., and even those are because of people who have traveled or immigrants who have been infected and then are bit by a mosquito here, and then that mosquito takes it and infects another person. Malaria is caused by plasmodiums, which are protozoans. There are over 100 species, but only 5 are known to infect humans. And these first 4 are the most prominent. The falciparum is the most common. It causes the most deaths every year because it multiplies rapidly and can adhere to the brain very easily, so it becomes very serious very quickly. Vivax and oval are very similar to each other. They both have a dominant liver stage, so they stay in the liver and can cause relapses months or even years after the person has been infected and treated. Malaria has a 3-day cycle, so it's also very serious, but it doesn't kill as many people as the falciparum. Malaria is associated with monkeys. It's very dangerous because it has a 24-hour cycle, so it's also very fatal very quickly, but it's not so common in humans. And of course, this plasmodiums are spread by mosquitoes, more specifically only the female mosquitoes. You can see here the difference between a normal red blood cell and one that's infected. You can see the malaria inside the red blood cells. This diagram is from the CDC, and it explains the life cycle, which is very complicated. It starts off with someone being bit by an infected mosquito, and that mosquito injects the sporozoites into your bloodstream. They then make their way to your liver, where they infect your liver cells. Inside the liver cells, the sporozoites mature into schizonts. Each schizont creates tons of merozoites, which rupture the cell, and then they are released back into your bloodstream. And it's in the blood stages that the disease is so harmful. The merozoites will infect a red blood cell, multiply inside of it, and then rupture that blood cell, so then the merozoites can go on to infect other red blood cells. A few of the infected cells will develop into gametocytes, which can remain in the bloodstream for a few days after the infection starts. So when another mosquito comes along and bites the same person, the gametocytes are what infects the mosquito. And then that mosquito will go on to infect other people. The gametocytes, once inside the mosquito, develop into sporozoites again, which is what's passed on, and the cycle starts over. Malaria's got a incubation period of 7 to 30 days. It starts off just with flu-like symptoms, which include fever, joint pain, headaches, vomiting, or even convulsions. And then if it's not treated, it becomes very severe, which is when you see anemia, low blood pressure, coma, damage to all your vital organs, including the brain, which is cerebral malaria, which is very deadly. And then sometimes you can see relapses, which is only in the certain species, and they can happen months or even years after the initial infection. To be diagnosed with malaria, they used rapid dipstick test or blood smears, which on the blood smears they can actually see the parasites, but the rapid tests are more common because they can be used in the field. It's often misdiagnosed because if you just have flu-like symptoms, you don't really know what it is, so they may give you malaria drugs, but that may not be it, so then that's where you get the resistance to the drugs. It is completely preventable. The easiest way to prevent it is to control the mosquitoes, the vectors, which carry it, which you can do by using insecticides, protective clothing, staying indoors, but in many places in the world that's not possible. People will work and sleep outdoors, and there's preventative medicine, which includes chloroquine, and that's the most common one, and that's the one they'll give you if you are planning to travel to any of these places. One of the most interesting things about it is the association with sickle cell disease. And sickle cell is a genetic disorder where people have an abnormal hemoglobin. Normal hemoglobin is disc-shaped and flexible, and the sickle cells are not disc-shaped. They cause blockages, which end up with pain in the tissue because they don't get the oxygen they need. You can see the difference between the normal red blood cells and then the sickle cells. And it's mostly found in people of African descent because of the evolutionary favor against malaria. And even people who are heterozygous for sickle cell are still partially protected. They treat it with quinine and chloroquine. And the best way, they also have to control the symptoms, so you have to control the fever, the seizures, and make sure they're hydrated. And some people will even need intensive care, but especially in Africa, there's a lot of counterfeit drugs, which is people who think they're treated and then can still be very, very sick. They have come out with they're working on a new vaccine, and they've worked on it since the 80s. It consists of three doses, and they give it to children of ages 5 to 9 months, and then a booster shot about a year or so later. And so far, it's in the 3rd stage of testing, and it's proved to protect children for at least 3 years after vaccination, but they're still working on it to make sure that there's no other side effects. And they should have it ready in a few years if everything goes well. They're trying to have it ready by 2025. And this video can be used by Dr. Blair however he wants to.